We were on a diet for 6 weeks. Then we ate a pizza, the whole pizza. Okay, it's not that it's all over. It's not all over, it's okay. What happened that day? Oh, we didn't sleep at all that night before because we were studying for an exam or we were doing a project. We didn't have breakfast or lunch either. So by the time 6 o'clock came, we were starved. So we smelled some pizza, we got a whole one, and we ate it. Well, what can we do differently next time? That's it. That's the learn and grow mentality. We can't just always eat asparagus. You're gonna have to try eggplant, and you're gonna want peas, and you're gonna want squash, and you're gonna want the things that are in seasons. Half of the plate, as I mentioned, vegetables and fruit. Mostly vegetables. Whole grains is a quarter, healthy protein is the other quarter. We don't want simple carbs because they lead us into the sugar cycle. Walk to work. Go for walks with friends. Walk on the weekends. Walk after dinner with your spouse. So many options. No, if you take breaks about every hour, just 5 to 10 minutes, that will rejuvenate you, refocus you, and you will be more productive. 5 minutes, that's all it takes. We have a lull at 3 p.m., and many of us go to caffeine at that time. I did. And it turns out, research shows us people with purpose live longer, have a lower risk of cognitive decline, have a lower risk of disability, and have positive relations with others. The pieces of the puzzle for the healthy body are physical activity, nutrition, and sleep. The pieces of the puzzle in the wheel for a peaceful mind are stress resiliency, attitude, and timeout. You can work on these body, mind, and heart pieces, but if you don't have action steps, if you don't look to create SMART goals, if you aren't constantly curious and investigating, then you're not likely to sustain this for a lifetime. That's what lifestyle medicine is about. It's not a quick fix. It is about a journey that lasts a lifetime.
Good morning, good afternoon, good evening, wherever you are in the world right now. Dr. Sal, Lifestyle Medicine, Medical Director, Lifestyle Medicine Institute for the CHIP program. I want to welcome you all to the program today. Thank you for being here. We have, as always, another fabulous guest today. I think we are going to have an exciting show for you today from what I saw earlier while we were prepping for the show. Dr. Beth Frates, I'll give you her bio. Let me read some of the information about Dr. Frates before she comes on the screen. And today we're going to be talking about health coaching. And I like the video trailer because it was really interesting how, she talks about the aspects of lifestyle medicine and how important it is to put all those things together. And health coaching is a big part of developing a lifestyle medicine program. So Dr. Frates is a trained physiatrist and health wellness coach. Her expertise in lifestyle medicine, she works to empower patients to live an optimal level of wellness. And I really like that word optimal because we want to achieve not just a level of health where you don't have a disease, but you really want to be optimally well and you want to grow in a vital way. At Harvard Medical School, she created the first lifestyle medicine interest group in 2008, which is actually still thriving until today. As a member of the board of directors of FACLM, she helped shape the scope of this specialty nationally. This is really a tremendous movement that we're involved in right now to help patients and providers understand that lifestyle medicine is the foundation and lifestyle behaviors is the foundation for what we really should be working on. She's an award-winning teacher at Harvard Medical School. She's an assistant clinical professor. She developed and taught a college lifestyle medicine curriculum at Harvard Extension School, which is actually one of the most popular programs that they have there. She shared a lifestyle medicine syllabus with us and actually downloaded, this was downloaded through the ACLM, through the American College of Lifestyle Medicine website, in hopes that it would really serve as a template for instructors and other professors. I actually have the book here, and there is an offer to purchase the book with the proceeds going to the college. And as the Director of Wellness Programming at the Stroke Institute for Research and Recovery at Spalding Rehabilitation University, she has created and implemented a 12-month wellness program for stroke survivors and caregivers. I like the fact that the program is for stroke survivors and caregivers because we have to take care of the people that are taking care of the patient. That's a really important point. She's the co-author of the book, Life After Stroke, A Guide to Recovering Your Health and Preventing Another Stroke. She's a co-author of 3 chapters on behavior change in different medical textbooks. And as I mentioned just previously, she's the co-author of the Lifestyle Medicine Handbook, An Introduction to the Power of Healthy Habits. That's the book, which was ranked in the top 20 by Book Authority for medical books released in 2018. And I will tell you, I am very proud not only to have her on the show today, but to tell you that she is the president-elect for ACLM, and I congratulate her again, and I would like to bring Beth onto the screen. So welcome, Dr. Frates.
Thank
Hey
you.
there. Nice to see you.
Thank you so much for having me. I'm outside, as you can see, enjoying the great outdoors because we all walk the talk.
I can see that.
We need to practice what we preach. So thank you so much for having me. And I can see from our chat here and the people that signed up, there are some friends and colleagues that have joined, and I'm delighted they're here, as well as new people that we have yet to meet. So thank you so much for being here with me, and thank you so much, Sal, for inviting me.
This is great. You know, we have had such fabulous people on the program. I'm excited to talk to you today about health coaching. Tell me and tell the audience how you got involved with health coaching.
Yeah, thank you for that. So it was in 2008 when I first started on this journey in lifestyle medicine here at Harvard at the Institute of Lifestyle Medicine. I started doing CME work here with Dr. Eddie Phillips and others. Mm-hmm. And learning the guidelines is essential. Knowing how much exercise we need to get, as we know, accumulate 150 minutes of moderate intensity physical activity in the week, what we need to eat, how much we need to sleep, all of that's critical, the guidelines. And at ACLM and in lifestyle medicine, we use the research to give us those guidelines. You can tell people over and over again the guidelines. You can wag your finger at them and you can yell at them. You can even try to wrestle them into following these guidelines. But that's not sustainable for you or for the patient or friend that you're working with. So behavior change to me became the secret sauce of lifestyle medicine. If we can empower people to make these changes, enjoy the changes, and sustain the changes, then we've really won. One thing, knowledge is power, right? Mm-hmm. Knowledge is power. But the thing is, it's not powerful enough to sustain change. Right. So that's what got me into it, really wanting people to not only know the guidelines, but follow them and enjoy it. Mm-hmm. And so it was in 2008, Sal, that I took my first health and wellness coaching class training. Mm-hmm. I was one of the first physicians to be certified as a health and wellness coach. And since that time, I've taken 4 or 5 other trainings. And I will tell you that it changed me in a lot of ways. It definitely changed how I practice lifestyle medicine. Mm-hmm. It changed how I collaborate with colleagues. It even changed how I work with my own children and family members.
I think you're going to change the show today from what I know is coming up.
I don't know about that. But so some of the listeners may be already coaches. I don't know. Perhaps you can chat in if you are a health and wellness coach. I'm just taking you on a little walk. If you are a health and wellness coach, perhaps you can just chime that in. Just if you can say yes, then I know I can call on you and ask you to help out here. What I'll do is assume most of you are not. And I will say that for me, the big difference, and Sal, this might be interesting to you, for me, the big difference between acting as a coach, a health and wellness coach, versus acting as a physician, really there are 5 main areas that I had to focus in on and act differently. One was listening. So when we're in behavior change mode and health and wellness coaching mode, we are listening more than we speak. And as physicians, we're generally talking a lot and we're advising a lot, right? Right. We're in the expert approach. We do need to do this. We need to advise, we need to talk, and we need to share our knowledge. Here's the thing. When we're in behavior change mode and health coaching mode and counseling mode, we really need to listen to the patient because they're the experts in their own lifestyle. They know what's worked for them. They know where they failed. They know their obstacles. They know what kind of strategies may work for them in the future. And using that expertise is critical. And the only way we can find out about it is actually if we listen. So listening is key. And then the way we share our knowledge, that's the second thing that's different. In the routine acute care appointment with a physician, the physician is sharing knowledge, basically as much as information as they can in as short a time as they can, because they need you to understand, or the patient to understand, if they have pneumonia, why they need to take a certain antibiotic and for how long. In our world of lifestyle medicine, chronic disease, and behavior change, we need to share knowledge when the patient is ready and willing to accept it. So we check in. One of the main differences for me when I do my health coaching work is I say, would you like to hear about how exercise will have an impact on your arteries, how exercise will have an impact on your diabetes? And I basically give them the option to say yes or no, right? So they're in charge. They have autonomy. It's their choice to hear it or not. And by the way, Sal, they don't always say yes. They don't always say, yes, I want to hear this. Sometimes they say, no, Dr. Sal already told me about that. And then I say, oh, okay, so would you like to hear instead about how stress resiliency and how stress management techniques could help you with your heart condition? And then they say, oh, yes, I don't know about that. And then I spend my time talking about the pieces of information that they want to learn about. And then I check in. Oh, I just talked for a while about stress resiliency. Tell me what resonated with you. What are you taking away? So instead of just launching in this tell and sell approach, I instead checking, one, are they interested? And then two, what did they learn? The next area that is different in health coaching is in terms of responsibility. So generally, I as physicians, it's our responsibility to find the right antibiotic, to find the right antidepressant, the right blood pressure medication for the patient. It's our responsibility to identify that. Now, with health coaching and behavior change, it's actually the patient's responsibility to find what resonates for them. So instead of me feeling like I had to find the right exercise, right? What's the right exercise for this patient? I realize my responsibility is to lead them into, I don't know if you guys can see, to lead them into options like, do they want to do the portable peddler, as you can see here? Do they want to use the exercise bike? Do they want to use a hula hoop? What do they want? What do they want? So a 74-year-old patient of mine, when I started health coaching, she was losing weight and doing really, really well with walking, for example, right? That was her choice. And then she said she was bored. So I said to her, well, what are you thinking about doing? Having no idea what she might say, right? What are you thinking you might want to do instead of walking? Because you've done great with walking, but I hear you want something else. You want variety, you want novelty, And so what did she say? She said, so Beth, you always talk about trying new things and wanting to do new things. So how about you and I take a class at the local recreation center here in Wellesley, and we'll take a hula hooping class together. So I bought a hula hoop right here. Right. Okay. I bought a hula hoop. You can't really see. There it is. I bought a hula hoop and we signed up for the class. Unfortunately, the class was canceled because 2 people signed up and 2 was not enough for the class. Just Mary and I signed up. Anyway, yes, I can hula hoop. Sal, yes, I can. And maybe we'll get that treat later. But let me finish telling you the differences. So the difference is you listen more, you share knowledge, just in time information they want to hear and are ready to hear. Right. You take responsibility is really it's the patient's responsibility right? And it's about collaborating with the patient, not dictating. It's about collaborating and negotiating with the patient, not me telling the patient what to do. It's very different, this health coaching. And to be honest, as I told you, I've done these 5 different trainings, and I've done some motivational interviewing training as well. And it is a very different approach, and it is now, by the way, a profession. It's always been a profession. Now they have actual national certification for health and wellness coaching. There's a board, National Board of Health and Wellness Coaching, and if people are interested here on the line, there's a website. NBHWC, National Board of Health and Wellness Coaching, NBHWC. And there are more than 3,000 health coaches now since 2016 that are board certified. And there are 50 different programs or more that are accredited for certifying health coaches. So if you go through one of those programs, you then take an exam, and you can get board certified. And as you said, a health coach is part of the lifestyle medicine team, or is often part of, as a welcome part of a lifestyle medicine team, because not all physicians are trained in this. Not all lifestyle medicine physicians are trained in health coaching and behavior change. So they partner with people who are. Now, some of us are trained in it as well as in lifestyle medicine. But not everybody is.
Really, listening to your patients will allow you to hear the diagnosis that the patient tells you they have. They're telling you their symptoms, and if you as the healthcare provider just keep your mouth closed for a while, you can actually hear what the diagnosis is that's associated with the symptoms. So listening is extremely important. Sharing your knowledge in a way that she described, so that you're understanding what the patient is ready to hear, what they're ready to do as far as change, getting feedback rather from the patients, so that you know that they've actually heard what you described to them, and that they've incorporated that into their own brains, and that they understand what their responsibilities should be. Reiterating the things that you talked about and gave them the website again. You had mentioned before, though, you have a 5-step approach.
Oh, yeah.
To the counseling that you can tell us about.
Yeah, absolutely. And hopefully that will help you guys if you're thinking about using this approach with patients, with family, colleagues, or even with yourself. So the first thing is to walk in the person's shoes, express empathy, hear their story. So as I told you, some of the differences, the main one was listening. The first thing you need to do, or we need to do when we're counseling, is really listen. So we ask, what brings you here today? What is it? What's going on right now that makes you want to change? And then you listen to the story. Then the second step, once you've heard their story and you're open-minded, curious, non-judgmental, the next step is aligning motivation. So really finding out, what is the motivator? I mentioned to you the 74-year-old woman and the hula hoop. Originally, she came to me wanting to lose 30 pounds because she was going to Florida. And her initial motivation was to wear a bathing suit.
There you go.
She was meeting a friend of hers, and they were going to sit on the beach, and she hadn't worn a bathing suit in years. So she said she wanted to wear a bathing suit. So, okay, I don't judge. Remember, this is express empathy, and there's no judging. I'm not going to judge her motivator. And the initial motivator is an external one, right? Wear a bathing suit. Right. I am hoping to get to an internal motivator at some point, meaning I love walking because I feel more creative, because I feel energized after the walk. I love walking because I'm calm. after my walk, and the rest of the day seems less stressful. Those would be internal motivators that I'm shooting for. But since she hadn't been on a walk in years when she first met me, I wasn't expecting her to feel those internal motivators. So this external motivator of wearing the bathing suit and losing weight was something I would work with. But eventually, as you heard, she did a lot of walking and lost weight and then got to the hula hoop. But her internal motivator, her motivator changed from wearing the bathing suit to just feeling good, feeling comfortable in her own body, feeling more relaxed. So after express empathy, align motivation, then we move on to building confidence. So she came to me initially and had no confidence. I don't know why I'm with you, Dr. Frates. I don't even know why I'm here. I've gained weight. I've lost weight. I've gained. I've lost for years. I go up and down 10 or 15 pounds, she said. So I said, well, tell me about the times when you've been successful. And so she shared that and started to get a little more confident. Then it was, tell me about your strengths. A great way to build confidence is, what are you good at? Tell me about your strengths. And then people suddenly, could see their whole language, right? They like sit up, like, well, I'm really creative. With my hands, I'm determined, I'm gritty. Okay, all these things are useful for behavior change. So we build their confidence, and then after that, the next step 4 is set SMART goals. Some of the people in the that are listening probably know SMART goals. Measurable, action-oriented, realistic, time-sensitive. It's hard to get patients initially to create SMART goals because they're used to, I want to lose 20 pounds being their goal. But we need to make that, I'm gonna walk after dinner 4 days a week, 20 minutes this week. We need to get that into a SMART action goal. And then after that, we need to set accountability. And that's the last step of the cycle. Where, you know this, Sal, we can set goals and we can say, oh yeah, I'll be on your podcast. But if you don't give me a date, if we don't have time, if there's no goal, it's not going to happen. Sometime this year, I'll get on the podcast. So because we set the date, right, we actually follow through with it. So with them, it's setting a time to check in with them or having an exercise buddy, identifying an exercise buddy for them. Or even tracking and logging with a pedometer and having them share that data with you. But then a 5-step cycle, because then the next time you see them, you express empathy, you look at the motivators, and as I told you, the motivators change, just like they did with the woman with the hula hoop. And then you go through the whole thing, build confidence, you set more goals, set accountability, and you go through this whole 5-step cycle.
It's really interesting the way you describe it, because I think most physicians should really see themselves as health coaches. I mean, one of the best things that I think we can do for people, aside from telling them what medication to be on, and hopefully not tell them, that they need a medication, is to be their health coach. Yeah. And when I do my presentations, I'll always ask individuals in the audience, have you ever hired a wealth manager? And everybody raises their hands. Everybody hires a wealth manager because they're concerned about their retirement. Well, have you ever hired a health manager or a health coach? And nobody raises their hands. And I will ask them the follow-up question, well, why not? Isn't your health more important than your wealth? If you spend your years in a very poor way and you get to your retirement years with no health, doesn't matter how much money you have at that point.
Right.
You're going to be disabled and die early.
Right.
So, I love the fact that you are a significant role model for healthy living. You walk the walk and talk the talk, but how do you really motivate more healthcare providers to do the same thing? Because that's an important part of our job.
Yeah, that's a great point. And I think, fortunately, as we have the annual meetings at American College of Lifestyle Medicine, there is, I have given workshops and lectures on health coaching there, and health and wellness coaching, motivational interviewing. So you can get some of that at our annual meetings, which is cool. And I think one idea that we have touched on a little bit today, and something worth emphasizing now, is we need to practice what we preach. And there's data, Sal, from 2000. So when I was a resident at Spalding in 1999, with colleagues, we surveyed family physicians, and we said, we asked them, are you exercising?
Right.
We asked them, are you doing aerobic training? We asked them, are you doing strength training? And then we asked, do you counsel on exercise? Do you counsel on aerobic training? And do you counsel on strength training? So we asked them all those questions, and and the correlation was fascinating.
Right.
One thing we found was those who exercise counsel on it. You probably guessed that. We also found those that did strength training counseled on strength training.
Right.
If you did not strength train and you were a physician, you did not counsel on it.
Yep.
Those that did aerobic training counts on aerobic exercise. So walking the talk is so important. And then Erica Frank, someone who does a lot of research in lifestyle medicine, and when she was at Emory, she's in Canada now, but when she was at Emory, she actually had patients. She did a research study where patients were going to see their primary care physician, and before they went to see them, they watched two different videos. One video, the physician was saying, you need to eat vegetables and you need to exercise and you're going to be healthy. If you don't, you're going to get diabetes, you're going to get heart disease, you're going to get a stroke, and, a lot of finger wagging.
Right.
In the other, the physician, it was 30 seconds worth. Both videos were 30 seconds worth. The other video, the physician said, oh, it's hard to get all the fruits and vegetables. And I know, I bring an apple in for a snack. And that's how I at least get one serving. And then the physician pulled out the sneakers and said, and it's hard to get exercise in, but I walk to work and walk home, and that's how I get it. And then the subjects were asked, who's believable, who's motivating,
right,
and the one that disclosed this. So for physicians, you don't have to be perfect. No. Nobody is perfect, right? Nobody's perfect. But if you're working on it, that's the key. If you're working on it, you can share that you're working on it, and it's priority for you, then you're motivating for the patient. And that's the essential ingredient. So then you ask yourself, well, we should be coaching each other. So physicians coaching each other, or learning how to really kind of work and coach yourself. Now that's hard, but you can take yourself through this 5-step cycle. You say to yourself, okay, where am I now with exercise, right? Where am I now? Am I meeting the guidelines of 150 minutes a week of moderate intensity physical activity? Am I accumulating that? No. All right. So what am I doing, and where do I want to be? Okay. So you go through that empathy. You're listening to yourself, figuring out where you are. Then you say, well, what's my motivator to actually get to the guidelines? Why do I want to exercise more? For me, it's always because I want to be calm. I want to feel creative. We know the data that if you exercise, you increase creativity. And I want to be fit. So then you go to building confidence. Well, I've done this before. I know I've reached the guidelines before. What did I have in place when I reached the guidelines? And then setting the SMART goals, putting it in your calendar. So for me, yoga, running, it goes in the calendar, like a podcast, Sal, like it's in the calendar. So when someone says, do you want to do something at, can you do something at 5? I simply say I'm not available. We don't have to tell everybody. That's the other thing I learned. You don't have to tell everybody everything that you're doing all the time, right? You don't have to say, well, that's my yoga day, that's my yoga hour. You're not available. Is there another time that works for you? Let's find another time. Now I will pull out the hoop for you.
All right, let me see it.
Let's see if I can do it now. Okay. So that said, the other thing, and we know that Dean Ornish says this a lot, right? Fun.
Yes.
Passion. That's what keeps us going. That sustains. Okay, I gotta get to the hoop.
Do that.
Right? So just having this joy in life. Like, people want to thrive. Yes, they want to be healthy. They want to add life to our years and years to our life. But how? Okay, wait, hold on. Well, I can do this while I talk. Hold on. So, like, how are we going to do that? How are we going to have more fun? How are we going to be joyful day in, day out, enthusiastic, like Dr. Sal?
There you go.
So I think
I can't do that, though.
I think this whole idea of trying new things,
Right.
being open, and this goes with diet too, right? Trying new vegetables. Don't.
Yes.
In the lecture in Ireland, I said, don't just eat asparagus. You got to try a whole bunch of things. That's the rainbow in the plate. So those of you who are doing running and yoga and nothing else, I'm going to encourage you to get a hula hoop like this one and try it. Because, by the way, it can be really good exercise. You can sweat. It's so cold out here right now in New England. I'm not going to sweat, but you can really sweat, work up a sweat hula hooping. So there's
before we finish now, I want to tell you, we have Dr. Hans Deal on the show next week.
Yay.
He's going to talk about how CHIP started. So I think what I'm going to do is put up a challenge to him. You just did the hula hoop on my show. I want to see what he's going to do to upend that.
I love it.
I know he's on the line listening today. So
yeah, I saw it.
This is your challenge.
Okay, but look, here's another thing.
Let me see the burpee.
Oh, the burpee. Okay, yeah. I'll do the burpee. But here's another thing, like just the whole variety. Do you see this? This is a portable peddler.
Yeah. Mm-hmm.
Right? It's so easy. So for patients, for us, you're sitting a lot at these Zoom meetings, right?
Yeah. Mm-hmm.
By the way, this thing is very inexpensive. I mean, it's like $50 or something. So if you're in your Zoom meeting and you can be doing your portable peddler, fantastic, right? I mean, then you're getting some movement instead of just sitting all day.
Right.
So Sal, I think you're sitting.
No, I'm standing. I have my stand-up desk.
Oh, beautiful. So I'm just checking.
I rarely sit down anymore.
Yeah, just calling you out on that a little bit. Okay.
This is my stand-up desk.
Okay. So you're standing, which is true.
Look.
So you could do a burpee.
I can do it.
We should teach everyone a blast burpee real quick. Wait,
Wow.
let's just see. Does anyone want to hear about or see the blast burpee?
Yes, of course we do.
Saying yes. Okay. All right, ready? Are you going to do this with me, Sal?
Yeah, let's do it.
Okay, hold on. So, guys, this is something you can do anywhere, anytime. Dr. John Rady, a colleague of mine here, he's a psychiatrist here at Harvard Medical School. He taught this to me, and I've been doing them with all sorts of providers and patients alike. They're very easy, but yet it's a challenge. They're deceptively challenging. Okay, so it's called a blast burpee.
Mm-hmm.
I'll show it to you. I got to clear out my hoop. I don't want to hurt myself.
Right.
Okay, so what we're going to do is you put your arms out, you pull them in tight, you drop down to the floor, touch the floor, and then jump up as high as you can, and then arms out, pull them in tight, drop down, okay? We're going to do this 10 times. So whoever's on the line, okay? Whoever's on the line, please join us. We're going to do this 10 burpees. And can someone count? I don't know, because I always lose track. So someone better count. Okay, ready? Here we go. Arms out, go. Arms in, touch the ground, jump up. Arms out, 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 touch the ground, jump up. Arms out, in, touch the ground, jump up. Arms out, in, touch the ground, jump up. One more.
One more.
Okay, I have no idea.
I think we're 10 now.
Okay. Thank God you're counting. Okay, so it's about. Aren't they fun?
That was a blast.
Yeah, it's and you get a little energized. So if you're looking for that 3 p.m. wake me up, here's a good 3 p.m. wake me up and get motivated. It's called a blast burpee.
So give us the summary. Give the audience a summary of what we want them to take home. Yep. And actually start using today. Okay,
perfect. So if you're working to help people change behavior first of all, fun is critical.
Yeah, that was fun.
Make it fun. That's number one. If you're going to use health coaching techniques, you really got to think about collaborating and negotiating.
Mm-hmm.
It's going to invite you to use your ears and to listen a whole lot more than you're used to doing. And it's going to invite you to honor and acknowledge the patient as an expert in their own life and experience, which will help to create a program that is sustainable for them. And then I would like you to consider using the 5-step collaboration cycle, where
that's great.
what you do is express empathy, so that's listening.
Right.
Then you align motivation.
Mm-hmm.
Then you'll build confidence.
Mm-hmm.
And after that, you'll set those SMART goals and then set accountability. So when they see you again, you'll start with empathy, where we always start when we meet someone, right? A friend, a patient, whatever. We're starting to get on the same page, and we want to have empathy. So I hope that is useful to you, and I hope you did also try the blast burpees.
Well, we're going to get some feedback from the audience for sure. I can tell you this was probably one of the most exciting shows that we've done. It's probably the one that probably spiked my heart rate up more than others. Dr. Deal next week will have his challenge. I'm really excited for the future of lifestyle medicine, number one. And we had Dr. Kate Collins on a few weeks ago as the incoming president. Number two, you following up after her. With Dexter's leadership and so many of the other people that we've met over the years, which really has been amazing. I know that healthcare is going to be delivered in a very different way than when we started practicing medicine. So I hope that, I'm sure that everybody in the audience really loved today's presentation and your talk. I want to thank you for your leadership and for being such a great role model for healthy living and everything that you do for us. Before we end, I want to thank Daryl Luddington. Daryl is a fabulous behind-the-scenes producer for the program, always gets us through the program in a great way. And to remind the audience that all of these programs are taped, so you can go back and see them again on the chiphealth.com website. And the website that you gave again was nbhwc.org, correct?
Yep, I'll double check right here. I wrote it down just to make sure.
Yeah.
NBHWC.org, yeah.
Well, thank you so much for doing this. This was exciting. It was great. I learned some new things. I'm going to have to try the hula hoop now. Let me give you the last word before we sign off.
Oh, just thank you so much. And thank you for the engagement. I'm reading the chat. I've been trying to read it as the show has been going on. I really, really appreciate everybody taking the time to listen. And Sal, thank you for having me.
This was great. Thanks so much, Beth. You stay well. Thanks, everybody, for joining. We'll see you next week, same time. God bless.